Okay, so now we're going to talk a little bit about staplers. There's all different shapes and sizes. Small staplers typically hold about 10 to 12. Bigger ones can hold as high as 30. When we look at this stapler, the way these work is you hold it with your index finger and you use your thumb to fire. So if we're looking at the staple as it's coming down, you see the two edges of the staple. They're going to grab the skin on each side of the laceration, and then as you push it in, that's going to pull together and pull that skin edges together, and then once you let it go, it'll pop through. So that's what it would look like outside of the skin. So let's see what it looks like when we're doing it. We've got our laceration. We want to, after we've cleaned it and irrigated it, we're then going to help pull those wound edges together. And as we get ready to do this, we want to make sure that there's none of that fatty tissue sticking up, because that's no good. So we want to make sure it's all nice and clean. And we get the wound edges together like so. When you bring your stapler in, you're going to bring it 90 degrees to the wound edge. And then you're going to have to give some downward pressure and then push with your thumb. And as you're doing that, you'll feel it give. Then you just let your thumb up and you pull it up, and your first staple is there. Now, in this case, there's still a little bit of fat in the way. If we don't like it, we can then take our hemostat. If you don't have a staple remover, which some don't, you come in with the hemostat and just spread it open. And as you spread it open, it'll help unlatch those, and you can pull it out, toss it to the side, and then start again. These are very, very nice for the scalp because they're easy to do, and cosmetically, you're not going to have much trouble with scalp wounds because they bleed so much. But in other areas, like in the arm or the leg or other places, it's probably not real preferable. You'll see he's done a lot post-op total knee replacement, total hip replacements, because they're much, much quicker. Cosmetically, not as appealing. The other problem I see sometimes is that the nickel that is used for these can be an irritant to skin. So I don't use these very often outside of the scalp.